Have you ever heard that a patient relative beat up a nurse in the hospital? Or maybe you've watched a video online where family members were shouting, pushing, or even attacking healthcare workers because they believed their loved one wasn't receiving care quickly enough. If we are being honest, when someone you love is fighting for their life, fear can make you react emotionally. But today, I want us to look at something many people don't realize. Violence against nurses don't save lives. It can actually cost lives. Let us talk about why. Imagine this. A patient is rushed into the emergency room after a road traffic accident. The nurses immediately begin checking the patient's airway, breathing, circulation, blood pressure, oxygen level, and pulse. One nurse is trying to insert an IV line. Another is preparing emergency medications. Someone is calling the doctor. Everything is happening at once. Now imagine a family member walks in and starts shouting, "Why is nobody treating my brother?" Within seconds, people gather. Arguments begin. Someone grabs a nurse. Another person starts recording. Security is called. Suddenly, the attention that should have been focused on saving one life is now divided. That is how emergencies become even more dangerous. There's something people don't know. In emergency medicine, the patient who looks sickest isn't always the one who is treated first. Healthcare professionals use a process called triage. Triage simply means treating the patients who need immediate life-saving intervention first. So if your loved one has been waiting while another patient was rushed inside, it doesn't necessarily mean they were neglected. It may simply mean another patient was in a more critical condition. Another misunderstanding is that many people think nurses make every decision in the hospital. The truth is, nurses have specific responsibilities. Doctors prescribe many treatments. Laboratory staff process tests. Radiographers perform imaging. Pharmacists prepare medications. Administrators handle payment and documentations. Nurses coordinate much of the patient's care, monitor their condition, and carry out treatment, but they don't control everything that happens in the hospital. So, when something is delayed, it isn't always because the nurse isn't doing their job. Now, let me ask you a question. If the person trying to help your loved one is injured because of violence, who will continue the treatment? If nurses become afraid to attend to aggressive families, who suffers the most? Of course, the patient. And that's the painful truth. If you are worried about your loved one, speak up. Ask questions. Request an update. Tell the nurse that what you are concerned about. Most healthcare workers are happy to explain what's happening when they have a safe moment to do so. Respectful communication builds trust. Violence destroys it. I also want to remind us that nurses are human beings. They get tired. They miss meals. They stand for long hours. Sometimes they care for dozens of patients during one shift. Despite all that, they continue showing up because they chose a profession dedicated to helping others. No healthcare worker deserves to be insulted, threatened, or assaulted while trying to save lives. So the next time you find yourself in the hospital emergency, remember this: stay calm, give accurate information, follow instructions, ask questions respectfully, trust the healthcare team to do their work, because at the end of the day, everyone in that emergency room has the same goal: to give your loved one the best possible chance of survival. If this message has changed the way you think about hospital emergencies, please share this video. You never know whose life or whose attitude it may change. And if you enjoy health education content that helps you understand what really happens inside hospitals, don't forget to subscribe. I will see you in my next video.